Good day, my name is Brenda Crabtree-Ramirez and I work at the Infectious Disease Department of the Instituto Nacional de Ciencias Médicas y Nutrición Salvador Subirán here in Mexico City. And I thank the organizers for giving us the opportunity to present our study on behalf of the co-authors entitled Frequency of COVID-19 and Access to SARS-CoV-2 Testing Among People Living with HIV in Mexico Results from an Internet Survey. So as you might know, SARS-CoV-2 pandemic has tremendously affected Latin American countries since March 2020. Out of 2.8 million deaths registered worldwide, 700,000 are from the Latin American countries, and Mexico with a high death rate near to 10%. Recent findings suggest that people living with HIV might have a higher risk of COVID-19 death, and here in Mexico, people living with HIV has not given the priority to vaccination. Mexico is one of the countries in the region with less access to SARS-CoV-2 testing for many reasons and have many restrictions, such as only in suspected cases are tested, with few hospitals with free testing. So we think the proportion of HIV population in COVID-19 is underrepresented. So we did this survey that was online, which is retrospective descriptive study in which people living with HIV were asked for clinical symptoms that could indicate SARS-CoV-2 infection. We started this survey in November 2020, and we asked for symptoms between March 2020 and March 2021. We first did this in our clinic. We opened that to Clínica Condesa and then to social network. Our primary outcome was to describe the frequency of suspected cases of COVID-19 as defined by the WHO in patients living with HIV, and we also registered the demographic characteristics, last CD4 cell counts and viral load determination, if they were on ART, access to SARS-CoV-2 testing, and the reasons for not testing. So these were the results. 709 people answered completely the survey. Of them, most of them were men with a median age of 40. Most had undetectable viral load in the last determination with high CD4 cell counts. 1/3 of them, which were 218 patients, met the WHO criteria of SARS-CoV-2 suspected cases, and 60% of them did not get a diagnostic test. Those who had access to a diagnostic test, 63% turned out to be positive. 37%, which had no symptoms or met the criteria of suspected cases, which represented 24%, which represented 3%, had a positive test, which were the asymptomatic or mild disease patients. Patients who did not perform a diagnostic test reported that the main reason was no perception of risk in 1/3 of them, followed by high cost 12%, fear of testing 3%, and other reasons not specified in most of the cases. So when comparing suspected patients and asymptomatic patients, most of them were diagnosed in the public sector. When we divided into suspected cases and suspected positive and asymptomatic patients, they had similar ages. Most of them were male, most of them with CD4 cell counts above 200. Most of them were undetectable, especially in those asymptomatic. All of them were on ART, and most of them, 60%, had a comorbidity, and especially those who had overweight and obesity, especially in the suspected cases and the asymptomatic cases. So with this, we conclude that although the internet survey may have several limitations, they are feasible and useful. People living with HIV and COVID-19 might be underrepresented in the national register according to our data. Most of the responders had undetectable HIV viral load with high CD4 cell counts and were all on ART. 60% of those defined as suspected cases and 1/3 of them testing positive had associated comorbidities, which more frequently were overweight and obesity, which is a traditional high risk factor for a bad outcome in COVID-19 infection. Most of the patients defined as suspected cases did not perform SARS-CoV-2 test, and the main reason was no perception of risk, which is really interesting. This is an ongoing study in which it will be the thesis of the infectious disease fellow, Dr. Serrano, and we will measure the antibodies of SARS-CoV-2 and their last HIV viral load determination after the symptoms were reported, if any, and we will follow up on those eventually vaccinated when people living with HIV will get access to the vaccination. I want to acknowledge all the co-authors of this study and the collaborators and caregivers of our clinic and to all our patients. Thank you very much.